Studio 701.
Now, getting your little one to sit nicely in the dentist chair may sound like a challenge, but there are definitely some things you can do to make the experience become a little easier routine.
We talk with Michaela Davidson, dental hygienist at Polish Dental, to find out what you can expect.
The dentist can be a scary place. There's lots of new noises, sounds. We want them to lay down in this chair and have a stranger look in their mouth. So it can be very intimidating. But it seems like the more that we explain things, let them feel what we're doing. Feel the polisher, hold my mirror, feel the suction on your hand, then it's not quite as scary when they realize that nothing hurts. I've always loved kids. I babysat when I was younger, and I have 2 kids of my own, so I feel like you kind of learn a few tips and tricks to use to get them to kind of follow along and do what you want them to do. Does it spin so fast? Should we see if it spins on your teeth? Sometimes if they're really having a hard time, we'll give them a hand mirror so they can watch us, because then they just feel a little bit more in control, and just keeping it fun. There are so many adults that had terrible experiences as a child and to this day are still terrified to come in. So if we can keep it light and easy, and if the first time they come in, they won't sit by themselves, but they'll sit on your lap, we count that as a win. If all we can do is count the teeth or get a quick look, then that's all that we can do. We're never gonna force them, hold them down. We want to keep it a positive experience for them. 6, 7, 8, 9, 10. They're all there. Obviously, kind of those pits and grooves in the back of the mouth are harder to reach areas with the brush, so if we can get a good look at those, that's great. Usually between, 3 to 5, depending on how they do, we'll take x-rays to check between the teeth for cavities, because a lot of times if they're little and they're getting cavities between their teeth, we can't see them just by clinically looking in the mouth, so those x-rays come in really handy. Do you see my mirror? Can you open big like an alligator? Say, ah. Maybe talking about areas that they're missing when they're brushing. A lot of times too, it's just communicating with the parent and letting them know, hey, you should avoid this, or make sure you're using, a toothpaste with fluoride in it, going over diet and things that they can do at home to really set their kids up for success at the dental office and just with their teeth in general. Don't talk about how nervous you are for them, or if you have a lot of fear, don't let them see that. Keep it positive, talk about how we're gonna count their teeth, sparkle them up, try to just encourage them and keep it as lighthearted as you can, because that's how we want them to feel when they come in. We want them to be comfortable. We don't want them to be afraid or nervous because you've been telling them that we're gonna do certain things. Oh, that one's just for the dentist. Do you want the Buzz Lightyear one? Yeah, okay, should we go get a prize? Okay, that'll help you get down, okay? Just don't be nervous to bring them in. A lot of times when they're little, when they're, say, 1, at home you can get a really good look. They might sit a little bit better for you at home than they will for us here. But if you ever see anything that catches your eye or that you're concerned with, we will see them at any age. But it seems like around 2.5, between 2 and 3, we have the best luck with really getting a good, successful first appointment. So if it doesn't go well, then it doesn't go well, and we try again in 6 months, and it's not a big deal.
All right, that was an adorable little patient, we have to say. Now, Polish Dental is located in Bismarck and accepting new patients. They utilize state-of-the-art technology with gentle care and create personalized treatment plans for their patients' individual needs. To schedule an appointment, you can call them at 701-222-4746. You can remember that. It's 222-GRIN.
I like that.